If you ask most people in the country what matters most to them, the answer would be the NHS. And it follows from that trying to make the NHS as good as it can be is massively important.
None of this is easy. None of this is pretending that this is an easy thing to do. And the more honest we are about how we're doing it and some of those challenges, the better the chance of success that we have.
You know healthcare has to change. Everyone in the world knows it has to. It's unsustainable right now. It isn't meeting the needs of our society. It's not organized around prevention. It isn't team-based. We have to change. Shifting the center of inquiry from what's the matter with you to a different question, which is what matters to you. And that concept of what matters to you care reorients the goals.
For us, one of our patches, Farnham, is going faster, so the people in Fleet are saying, why can't we have what's going on in Farnham? And then that's encouraging our people who are on the front line. So I think real power to the people, actually.
I think we know what good looks like at an end state, but what does good look like in terms of getting there and the key building blocks and how we can help through our work share that with the systems.
And I want to emphasise that the patient should be at the heart of all this change.
Can something that's been done very well in one GP practice in a Vanguard spread to all the GP practices?
In terms of the care of older people, we do very much know what good looks like. But one of the biggest challenges is everybody hasn't got time to learn and pick up and go at speed.
What we're learning in stroke, we are sharing with the cardiologists. What we're learning in cardiology, we're sharing with the radiologists.
The work that we're doing through the New Care Models programme is sharing what's happening nationally. We've understood from people that they need the time, they need the space, they need to read it, they need to see the data, and really importantly, they need to feel it and touch it.
If I ran an STP and I wanted to be a spread guy, I would give people plane and train tickets. I'd say, Farnham, go visit File Coast, and File Coast, go see modality. I just think there's so much that can happen when you realize you're all learning together.
I would argue that in most communities around the country, there's a lot of resource and expertise in those out-of-hospital services. We don't use it very well. I think there's a huge amount of duplication within community health services, the overlap with social care, what practices are doing as well. And if we could really get our minds around that and put the effort into how do we use what we've got to support the implementation of the new care models and the STPs, that would actually take us a long way. And many of you are doing it. So I'm preaching to the chapel here, but I want to reinforce the importance of us all putting our minds around the opportunities there.